People always say, I just want to have a peaceful death. Here is how I can help you with that. When I was writing my book, that was the question that kept popping up. How do I help people understand how they can have a peaceful death? Over the years of me being a hospice nurse, I saw specific things patients of mine did that led them to have a peaceful death. And then I saw specific things that patients did that led them to not have a peaceful death. So this first chapter is all about that. I'm gonna read you parts of it and we can talk about it, and hopefully I can set you at ease a little bit. Okay, so this is on page 9. I'm afraid to oral read here, but I'm gonna do it just for you guys. So this talks about my death doula friend who gives an amazing analogy about planning for death versus not planning for death. And that's one of the biggest things I see. People who plan for death will tend to have a more peaceful death than those who do not plan for death. Okay, so here it goes. My friend, Ashley Bryan, a death doula and the founder of Distant Shores Death Care, go check her out, uses this analogy. Imagine you're on the beach with the ocean in front of you. The ocean is death. Will you get pulled into the ocean via the undertow against your will, kicking and screaming? Or do you cross this ocean in a boat you made with your friends and family beside you, shoving the boat off and sailing off of your own accord? This is the difference between a prepared death and an unprepared one. Ah!
That was good.
Ashley! I know. Thank you, Jeff. Did you guys hear him? That's exactly right. That's exactly right. A prepared death versus a non-prepared death. That's the one thing that I've seen in all of my patients, the ones that were willing to talk about the hard stuff, willing to ask the questions about how long do you think I have? What can I expect? What should I do before I die to make this easier for my family? Those questions, when asked, help people have a better life and a more peaceful death. End of story. I mean, I've seen it time and time again. Let me just give you an example. And this story is in here as well. And this is hard to do, mind you. I'm not necessarily able to do this either, but people who are willing to accept that they need help now. People who are willing to accept their lives have changed physically. They can be flexible in how they are living now. You're used to being super independent. You're used to going to work. You're used to doing this, you're used to doing that. Now you can't. The people who are willing to understand that, accept their limitations, ask for help, be flexible in how their life is going to look now, they seem to live better for the rest of their days before they die. And they do seem to have a more peaceful death. A great example, like I was just saying, is a family that I went to go see, doing a regular follow-up visit. So there wasn't, of course, the person was dying. They were on hospice, but they weren't close. They weren't actively dying yet. And I went to go see them and they were lovely and they had a wife and children and grandchildren and they were all kind of there visiting. And the patient was alert and oriented when I first arrived, right? 20 minutes later, I'm kind of charting in the kitchen and I heard him kind of make a noise and like sound a little different. So I went back in there and I could tell something had happened. Something had flipped in him where he was suddenly declining and quickly. He was mostly unconscious. He started having weird changes in breathing. So this was a sudden decline and it looked like he may suddenly die, which is uncommon actually on hospice. But what I noticed was because this family and him were so prepared that instead of the family, oh, chaotic, what happened, what's wrong with him, oh my God, and not really in reacting in an emotional way, which is very normal. It's okay. I mean, I get it if you do that, but I'm saying because they were really prepared, they didn't do that. They flipped along right with him and laid in bed with him, understood immediately what was happening. They didn't panic. And the wife got to literally lay next to her husband, rubbing his face. The kids were all by him. The grandkids were all in there. And they were just saying wonderful things to him. It makes me cry every time I think about it. That vision of them all being able to understand what was happening, even though it was a change and a change they likely didn't want, they knew it was happening and they all just accepted it and got in bed with him and were saying, you were so easy to love. Thank you for loving us. Thank you for being the best dad. Thank you for being the best husband. Thank you, thank you, thank you. I, as a hospice nurse, was like, I don't even know if I could have done that. But seeing someone else do it it gives me chills just thinking about it because it was so beautiful. That could have been so different because it was so soon and so quick and so sudden. But because they were willing and able and ready, it was this beautiful moment of love. By the end of that visit, he died. So he went from like kind of looking okay to dying at the end of the visit, which is hard. But that family made it a beautiful moment. because they were ready and prepared and able to be flexible and just say all of the things they've ever wanted to say. And it was truly one of the most beautiful deaths I had ever witnessed. I left that house and went in my car and like wept tears of, I don't know if it's not joy, it's like overwhelm. Like it was so beautiful that it made me weep, not just cry. I was like in my car, like heaving because I thought, I want to be like that. I want to be able to do that. And how can I help other people know that that's possible and that they can have those moments too? That death doesn't have to be chaotic and scary, even when it seems sudden and quick. So I keep saying plan, plan, plan. So to me, planning helps people have a more peaceful death. So what does that actually mean? What do you plan? Talk to your loved ones. Everyone talk to each other about what they want at the end of life. Specifically, do you want to be at home? Do you want extensive treatment? What happens if you have a cardiac arrest? I mean, very, very detailed things. And it's going to change, depending on what age you are, but at least have a general understanding of what you want. Now, specifically, if you're on hospice and you're at the end of your life-ish, you really need to get clear with your family and friends about what you truly want so they know. So in a time when it feels scary, they can remember what you said you wanted and they can respect that. Have mortuary plans. Write your obituary if you want to write it, or tell your families what you want in it. Do you want a living funeral? Have those things already set up so your family doesn't have to do guesswork. So following medication regimens can actually help as well, because that's going to help manage your symptoms. So if your symptoms are really out of control, it's pretty hard to have a peaceful death, right? Which I'm going to get to a disclaimer in a second, but trying to keep your medication regimen organized and under control. And if symptoms aren't being managed, you need to call your hospice company so they can help you. And if they're not helping you, which they should, but let's say they're not, you can always switch hospice companies. Remember that. Like I said before, embracing the new normal. I always think about myself too. Like I would have a really hard time losing independence. I would have a really hard time living in the gray and not knowing exactly what's going to be happening. I love living in the black and white. But people who are willing and able to accept changes, accept that they're losing independence, being able to rely on other people who are willing to do it, willing and able to do that, always, always, always live better and die better. Always. The patients who are unwilling to accept help, unwilling to accept that they have physical limitations now, always have issues. Always have falls, get hurt, end up having to leave their home. It gets messy. So please work on that if you know you're someone who will have a hard time with that. I am working on that because I know I'll have a hard time with it. Listening to your body. Listen to your body. If you have a terminal illness or a life-limiting illness, even if you're not on hospice yet, but you do have some kind of disease that you are getting treatment for, listen to your body. And if you are the loved one of someone who has this, let them listen to their body. If they're telling you they don't want to eat, don't make them eat. If they're telling you they want to sleep, let them sleep. As long as they are clean. That's the only thing I say. As long as they're clean, they can do whatever they want. So if they want to sleep, let them sleep. Don't make them do anything. Allow them to listen to their body. The other thing that family did that made things so peaceful was not only was the patient able to kind of transition so quickly, but the family was. If you're the family around the patient who is in hospice or getting close to their end of life journey, you as the family need to also work on being flexible, knowing that things can turn. And if they do turn, you're going to already know what your loved one wants, right? So this family saw their loved one be alert and oriented. And then suddenly he wasn't alert and oriented. But they knew he didn't want to go to the hospital anymore. He wanted to die peacefully at home. Was it more sudden than they were expecting? Yes. But because they knew that and they were prepared and they were able to be flexible, they were flexible and kind of just accepted what was happening in the moment and had this beautiful moment with him. So caregivers, the way to do that is to just remind yourself that, like, are they clean? Are they safe? Are they comfortable? If they are all of those things, even if something has changed, we know that they're clean, safe, and comfortable, and this is the moment just to be with them, just to be with them. I will say it might have helped that I was the hospice nurse and I was there in the home to tell everybody, hey, this is okay. So if this does happen and you don't have the hospice worker there and it does scare you, you can always call the hospice company and say, hey, this is what happened. There's been some kind of sudden change. We're okay. We're going to be here with him, but can someone please come out to support us and just to double check him? So that's something you could do as well. A little disclaimer and side note that I want to say. There are some specific diseases that are more difficult than others. So I don't want to just put this in a nice pretty bow and act like all you have to do is prepare for death and you'll always have a peaceful death. I know there are probably some people listening to me right now being like, listen, we were as prepared as we could be and our loved ones still had a difficult death. Please know that I know that. I am speaking generally here, and there are certain diseases that are just tough. There are certain diseases that will have a lot of symptoms and will be they will need to be closely monitored because of those symptoms. But I would say 9 times out of 10, if someone is on hospice, we can get them to have a peaceful death. We can. And preparing is just one big part of that can help. The other side of this is the non-peaceful death, the other side of things that I see a lot on hospice. And there is a similar story in my chapter 1 talking about a family that didn't have the most peaceful death. And it was mostly because they weren't prepared and they refused to talk about things. So if there's one thing that has become clear to me in my practice is that the patient and the families that are willing to talk about things and prepare themselves will have a better experience. End of story. End of story. So in this story that I talk about in my book, it's a family where, for whatever reason, I get to their house to talk about hospice, to admit them onto hospice. And it's very clear to me when I start talking about it and I start saying the words death and dying and end of life journey, that they're all pretty shocked. You know, they're all like, end of life, what? No, she's not end of life. She just needs extra help in the home because she wants to live here with us and not go to the hospital. And when I started understanding that no one really understood that she was at the end of her life, I knew I had my work cut out for me, which is fine. I don't mind talking about that. But then I realized not only did they need someone to explain what was happening, they were unwilling. So when I started talking to them about what was truly happening, because I could look at the patient and tell that they were close to death, they were unwilling to hear it. No, this is not happening. No, we have an herbalist that we're going to contact tomorrow. She's going to drink X, Y, and Z drinks. This is how she always looks. They were just unwilling to accept what was truly happening. And of course, I have to meet people where they're at, right? Like I can't force people to understand. And what happened was that person ended up going back into the hospital and dying in the hospital, which she did not want. And there are probably many factors that came into play there, but one of the things that I saw was the patient and the family being unwilling to acknowledge that this person was getting towards the end of their life, that they needed extra help, that they needed certain medications to help with symptoms. And it was just a wall. They were unwilling to go there. And because they were unwilling to go there, this person did not have a peaceful ending. The last thing I'm going to say to you guys is, think about this. We plan for everything in our lives. We plan for everything. We plan for babies, we have baby showers, weddings, we plan for vacations, we plan for buying a house, we plan for everything. But we never talk about or plan the one thing that's going to happen to all of us, which is dying. We don't plan it. We don't talk about it. We don't act like it's happening. We live in this world of like, it's never going to happen to any of us. And then when it does, we are shocked. So let's not do that anymore. Let's not do that. This is your call. This is your call to action, to start thinking about it. Start talking about it. It's not going to make it happen any sooner just because you do. If anything, it's going to prepare you so you have a better experience. So let's talk about it. Let's plan for it. That is going to help you have a peaceful death, which is what everyone says they want. I hope that helps. Love you guys.